Mr. John Day arrived at the medical center Angelholm for a consultation. At the registration desk, Mr. Day was advised and sent to the doctor's office. At the outpatient unit, he was examined by a professional orthopedic traumatologist, who formed a detailed plan of examination along with preliminary plan of treatment. The data obtained from digital radiography is recorded in the medical database of the center, which allows the doctors to receive the examination results at any workplace, whether it is the examination room, operating unit, or the doctor's office. This information is saved and will be available to the doctor in any case the patient returns again in the future. Following the examination, the doctor will inform the patient about his knee condition, as well as provide him with additional recommendations and further steps required for further treatment. After additional inspection and finalization of the treatment proposal, the patient undergoes a comprehensive examination. In this specific case, a knee replacement surgery is required. The doctor will ensure to provide the patient with the clear and detailed information on the future surgery, as well as tell the patient about the types of knee implants used in the clinic. The option with best fit will be chosen for the patient. The patient is then taken to an examination, where careful inspection is performed by professional specialists. Furthermore, laboratory examinations and interview with anesthesiologists also take place in the diagnostic department of the clinic. The patient is then required to fill out a questionnaire about his health status, which is followed by his hospitalization, where he can rest in comfortable conditions. Mandatory preoperative examinations are performed: blood tests, echocardiography, densitometry, fibrogastroscopy. The standard package of preoperative examinations can be expanded to suit patient health and the scope of the proposed intervention. The date of surgery will then be assigned with the patient's time taken in consideration. Therefore, to maximize our efficiency, the surgery will be performed on the same or the next day of the hospitalization, of course, if it is possible and agreed.
You are here in our clinic in Angelholm. How you get here?
We came here by car from Lviv.
From Lviv, you come here in Chernivtsi. What is your impression about our clinic? Your first time here?
My first impression is what a beautiful building it is and how clean and lovely and organized. Very efficient, but still very appropriate for the people of Ukraine. I'm very happy.
How do you like the process of your appointment, of your diagnostic system? Everything?
It was all very smooth indeed, very excellent. And thank you.
In this specific case, Mr. John Day had his surgery take place on the next day of hospitalization. The surgery unit is the heart of our clinic. Modern equipment, diligent monitoring, and professional teamwork minimize risk and intervention time. The method of anesthesia is discussed during the initial examination by our specialized and highly experienced anesthesiologists and repeatedly reviewed by the doctors prior to surgery. Usually, regional anesthesia is used in the implantation of large joints. This is when the patient experiences immobile limbs but stays conscious during the surgery. The surgical environment is maximally protected against any infection pathogens by our modern ventilation system, which use tank filters to ensure the optimal air sterility. Furthermore, the medical staff is dressed in individual protective suits, further ensuring safety and efficiency of the procedure. As always, the coordinated team of professionals perform their job perfectly. After the completion of the surgery, the patient will spend some time under diligent monitoring of the medical staff and advanced equipment. The anesthesiologist performs an additional manipulation for a better post-operative analgesia, various blockages under the control of ultrasound examination. Rehabilitation begins a few hours after surgery. Modern anesthesia methods activate the patient on the day of the surgery, which significantly reduces the risk of complications and accelerates the onset of patient recovery. In 4 hours, Mr. John Day is able to get on his feet and take his first independent steps after the surgery. On the next day, John Day is already able to fully walk by himself. On the day of surgery, or on the next day, The patient is transferred to the post-operative ward, where orthopedic doctors and rehabilitators work together with the patient to ensure a quick and safe rehabilitation. Special and individual exercise are required for everyone who underwent surgery. Rehabilitation efficiently helps the patient to return to their independent life as soon as possible.
My name is John Day. John Day. I'm British, I come from England, and I happen to be in Ukraine. Of all countries, I'm in Ukraine. Now, why am I here? Well, I have been here many years, but I like being in Ukraine. I like Ukraine. I like it. It is a lovely country, and it's a peaceful and happy country. And the people have been very nice. They've all been very nice to me. And they've been very nice in this hospital, especially. I tried many different things. I worked in many different places. I worked for the British Council. Right after I left university, I went to the British Council, and it sent me to Africa, to India, to many parts of the world. 9 different countries I lived in, actually. All 9 of them, and I lived about 4 or 5 years in each. And then when they'd had enough of me and I had had enough of them, I suppose, I left the British Council, I retired, and I became an observer for the European Union and the Overseas Security Centre, OSCE. All right? So I looked at elections. That was a second career. My wife died, and I wanted a third career. I wanted to do something. I did not want to just sit there in Scotland and play golf. It would be very boring for me, I'm afraid. I wanted to do something different, so I came to Ukraine and I married Ola, who I had known for a long time and loved very much, and she is wonderful. And I live with her in Lviv, which is not long, it's 5 hours journey from this town. It's the center, it's the capital of Western Ukraine. Now, is it difficult? No, it's not difficult. It has an international airport. It has international contacts. It has lovely people, and I love to go all over the place, travel widely, which I do with Ola. All right? So that's what I did. I had a knee problem. I knew I had a knee problem. It was beginning to be a bit of a problem, a bit of a difficulty. And I did not want it cut off. I know that in England, they cut off knees. They cut them off just for the sake of cutting them off. And I think it was terrible. So I did not want to do that. And I said to people, everybody, what is the best thing to do? So I did what they advised. I went and had injections. I went and had cabbage leaves tied on. I had all sorts of complicated things done to my knee. It got a bit better, but it wasn't perfect. And eventually I said, enough is enough is enough. And there was one doctor in Lviv who was very sensible and said, oh, I knew exactly what to do. I know that I did the best thing. I have done it and I feel so much better. I've gone to Chernivtsi and I've had the operation. All right, Chernivtsi. So come here and have the operation. It takes, 10 days, 2 weeks. That's all. That's all of your life. That's all that it needs to be given, and you need to do it. So I did it, and I have not felt a thing. I have not felt a pain or, I would say, oh, blood, I don't like blood. Oh, I don't like pain. I don't like. The doctor was superb. He gave me an injection that immunized the whole of the bottom half of my body, and then he gave me operated, and he did it in, I think, 41 minutes. 41 minutes. And I thought he was just putting a little piece of metal in, but actually it was quite complicated what he had to do. He knew what he was doing, and he'd done it beautifully. And then there's a process of rehabilitation, of restoration. Of course, we all have to do that. But it could be done, And so I came and I did it, and I'm very, very happy. I have never been more pleased than I am now about doing it. I am walking with difficulty, with a stick, yes, but not with pain, not with agony, not with difficulty. It was all right. It was all straightforward. The leg was there. The leg wasn't cut off or anything. It wasn't cut off and taken away and put back. There was no blood. I didn't see a drop of blood. I did not see a drop of blood. I don't like blood. I'm not very good at blood. I don't do blood. I don't do foreign things like that. I think people should come. I think people should not suffer. They shouldn't go through the depths, the problems, the difficulties, the agonies of having this leg that they can't use. They should get it sorted and get it fixed. And they should telephone your company and organize it, come here. And I think it is very, very good. The first thing was to make an appointment by telephone. It's all that's needed. And the lady gave me the time and the date. And I came at the time and the date. I came thanks to Ola. We drove down from Lviv. We came and we had a base here, and we used the base, and we found a sensible place to stay. And so we were fine. We were happy. We went to the interview, and of course he could have said, the doctor could have said, no, I don't want you, or I don't think you need this, or I don't think you need that, or I don't think you need whatever it is. He may have said, he could have said, let's change things, let's do this, let's do that. But he said what I expected him to say, and it's fine. So we did that, and I did it step by step. Now, the check was very thorough. It was very thorough. It was careful and meticulous. They checked everything. They checked my calcium, they checked my x-rays, they checked, I had ECGs, I had, the whole lot. I had everything checked. Only then did I spend the night in the hospital, and the next morning, the operation. So it was quick. They got on with it. It wasn't, oh, well, we think you could perhaps, and in 3 weeks' time or 3 months' time, you could come back and you could do this. I know all those problems. I've seen those problems. I know that if you're not careful, you will spend a long time waiting for the thing. Get on with it, deal with it. It's simple, it's a simple operation. If the surgeon knows what to do, if he's clear, why should the good people of Lviv, Ukraine, why should they have it and you don't? Come here. My doctor was a very nice young man who spoke English, who spoke good English, and who told me what needed to be done. I was fully confident in him. I had no doubts whatsoever. And the thing is, never have a doubt. Never scratch your head and say, oh, I'm not sure I've got the best one, and should I try somebody else? And no, that's the wrong answer. That's the wrong way to do it. Trust the doctor. He's the only person who knows what goes on inside your knee. He will do it. He will do it well. He will do it very well. So he did so. And 40 minutes later, he said, there you are, it's all done. Now, he had a screen in front of me, so I didn't see anything. I had an injection in my back, so I did not feel anything. I know they were hammering and they were screwing, and I was surprised. I was very surprised how much work had to be done. But he did it all immediately, swiftly, carefully, and he did it accurately. And he knew what he was doing, and he knew why he was doing it. So that was perfect, and that was wonderful. I'm very, very happy. Please come and do it. The rehab center is like a home. It's got a lot of staff, it has got a kitchen, it's got food supplied and so on. It's got, everything is laid on, and comfortable bedrooms. Very nice. I'm very happy indeed. And I hope that in 4 days I will get much better, stronger and fitter here. I'm sure I will. Well, I've only had 2 procedures so far, both of which seemed very useful, very good ideas. First of all, I was put into some trousers that were filled with air, all right? And I'm told it was a very nice experience. It was a very, very charming experience. And then secondly, I had 2 electrodes put on me, and they were vibrating and giving the electrical impulse. I think they were very good. I think they were excellent. So I don't have any problems with them. I don't have any problems. The only thing I would say is, the food is wonderful in Ukraine. The food is wonderful. The food in this center here is very good so far. I've seen it. The food in the hospital is, well, hospital food. It has to be hospital food. So if you think you want something, bring a few bars of chocolate or something. Just something that something that's nice, something that treats you. Just do that. Bring that, and put up with the hospital food. Our hospital food is the same in every country.
My name is Olga Kurpil, and I'm John's wife. And well, apart from being very happy to be his wife, I'm happy to be here in Chernivtsi. I must admit that we had options. John's sons are educated and nice people in London. They live in London, and the elder son is a doctor. And of course, we prepared to have the operation there in London, and in which case we would have the insurance, medical insurance, and the operation would be for free. But still, we were very lucky that we ran into a doctor, a Ukrainian doctor, a friend of mine, and he himself had been operated, and he strictly recommended, his name is Ihor Haiduk, thank you Ihor very much for recommending this clinic, and he told us everything in details, and then after certain considerations, John and we decided that we would come to Chernivtsi.
Thanks.
And it was so easy, and starting with the arrangement, booking the consultation. And I still remember the day when we arrived, and we met so many beautiful and lovely people. To our amazement, people spoke English to us,
Yes,
right?
yes, they did.
And just the security man, Pan Roman, he spoke beautiful English. Then the manager, Vicky, I really don't know her title, but he is now a friend, I would say. Yeah. And a couple of nice words about the doctor of Vasyuk Sergei Volodymyrovich, who was just a perfect and a very efficient doctor. We had a consultation with him.
And I asked him if he had been to Britain, and he said no, he'd learned his English here.
Really?
Yes.
Oh, I see. But he had definitely study trips. So everything, just my impression about the hospital is so wonderful. So we're not in the least worried when I eventually said to John goodbye, and he went for the operation. And then when he phoned me back right after the operation, he was very happy.
Yes.
And he's still very happy.
And he's still very happy.
And I had a wonderful chance to see him, because on the next day after the operation, John was able to come down with the lift, of course, and with the crutches, but I saw him practically every day. And now we're here in the rehabilitation center. It's really like home.
Yes,
John was right. Yes, and so it was really good. And I strictly recommend this hospital to anybody, not necessarily for the Ukrainians, but also for European citizens. But it's, people might think, oh, come on, John is still a European citizen. After Brexit, he might be not a European citizen, but a British. Why he decided to come here? But this Swedish and Ukrainian hospital is really remarkable, with a good staff. Everything is so efficient, clean, and comfy and everything. So we are very happy that we came here.
Indeed.
Really, we came here, and we hope we'll be healthy, and we hope we will have a quality life, because I can see that. The remarkable thing about John's knee, that his leg was a little bit curved, and I sort of put up with that. But now I can see that it's straight, right?
Yes.
So
the doctor said immediately, it's straight.
Yes. Thank you very much to all the staff, all the doctors, and this clinic. Yes, one more thing. Paradoxically, John had spent 5 years in Sweden. He was a cultural attaché in Sweden, and now here we're in a Swedish-Ukrainian hospital.
Oh, I knew they're good.
Yes.
I know they're good.
So, thank you very much. We are very happy.
Very, very happy indeed.
Yes.
Thank you.